and we love to see people come back. We've had many winners in the past from that circle. All right, we move now to the state of Connecticut, the Supportive Housing Pilots Initiative with Ann Foley and Janice Elliot.
Good afternoon. I'm Ann Foley from the Connecticut Budget Office, and I'm here today on behalf of my colleagues in 5 state agencies to talk to you about our Supportive Housing Pilots Initiative. Back in the 1990s, Connecticut, like many other states, was struggling with a homelessness problem that was increasing. The solutions we had been using up until that point, primarily emergency shelters and housing affordability strategies, were not working. We found that many of the people experiencing homelessness had mental health, physical health, or substance abuse problems that kept them from maintaining themselves in housing, and they were cycling in and out of expensive acute care placements. So the homelessness problem was costly in terms of tax dollars as well as human lives. At that point, we knew we needed a different approach. So we teamed up with a new national nonprofit organization, the Corporation for Supportive Housing, to pilot a unique solution called supportive housing. Very simply, supportive housing is permanent, affordable housing matched with a variety of support services that are designed to break the cycle of homelessness. The Pilots Initiative was designed in 2001 to develop 650 units across the state of Connecticut. We have about over 400 of the 650 units occupied, and the results have been remarkable. I would like to highlight 4 major positive outcomes for you. First, of course, has been the impact on real people. These are people who had been chronically homeless and are now stably housed and connected to needed social, mental health, educational services, and most of them are employed. Many of them are employed. Second, we have positively impacted many of the communities where these projects are. We've been rehabbing rundown housing and increasing property values. Third, we've put into place an interagency mechanism which provides a solid foundation to continue to expand and develop this approach. Last year, we received funding and authorization for an additional 500 units. So this is really a long-term approach to addressing homelessness for us. And finally, of course, being from the Budget Office, supportive housing is a truly cost-effective approach. It costs slightly more than emergency shelters, but 80% less than skilled nursing facilities and 95% less than inpatient psychiatric facilities. So we've moved from expensive and crisis-based approaches to homelessness to a more humane and cost-effective approach. So with that, I'd like to introduce Janice Elliot of the Corporation for Supportive Housing, who's worked with us every step of the way.
Thanks, Ann. We know from evidence that supportive housing is a cost-effective and humane solution to keeping mentally ill and disabled people off the streets. At the same time, the creation of supportive housing is complex, and so much so that many states and localities are unsure how to go about making it happen. The single most important achievement of the Supportive Housing Pilots Initiative has been the creation of an effective system for financing and producing supportive housing that can be easily replicated by other communities. This model is based on a combination of 6 key ingredients. First, leadership by government working in tandem with the philanthropic and nonprofit communities. Second, agreement between the government agencies on the core principles of the housing and services to be funded. Third, clear housing production goals and timeframes matched by a detailed implementation strategy. Fourth, funding for the housing and services from a combination of agencies, but accessed through a one-stop application process. Fifth, capacity support for the nonprofit providers of the housing. And sixth, an ongoing commitment to quality assurance. This model is embodied in several working documents that can serve as templates for other communities. These include a memorandum of understanding that outlines the commitments and roles of the agencies, and a joint request for proposals that outlines quality standards and the funding process. The program has also inspired new approaches to building the capacity of nonprofits that create the housing at the community level. This includes the creation of the nation's first Supportive Housing Development Institute, which is now being replicated by CSH in several other states. The scale of the pilot's initiative is small, but it's mighty. Over the past year, New Jersey, Rhode Island, Ohio, and Los Angeles have sought guidance from the Connecticut program as they structure new supportive housing initiatives. And here in Connecticut, the Pilots Initiative has allowed us to build a solid foundation for the future by extending the reach of supportive housing to 30 communities and developing a base of over 75 providers statewide who are now experienced in the creation and operation of supportive housing. Thank you.
Lee Shore.
Would you tell us a little bit more about the interagency collaboration? Because some of us feel that you deserve an award just for having brought that about, and some of us feel that it's so hard to do that maybe there's no point in recognizing it because nobody else can do it. So tell us a little bit more about how you did it.
Well, what we did was bring together the 5 state agencies that had been responsible for providing services or funding to this population: the Housing Finance Authority, the Department of Social Services, the Economic and Community Development Department, and the Department of Mental Health and Addiction Services. And we worked together to develop the request for proposals, to select the best developer and service providers, and we continue to meet on a monthly basis.
Is that under your leadership?
Well, you know, it's a funny thing because when we were thinking about who was going to come and represent us, I came because I'm with the budget office, and oftentimes that office oversees the other agencies. But we really have had a very kind of democratic system. Lately, the Housing Finance Authority has taken kind of a leadership role because we're in the development phase. So I did a lot of work in the beginning getting the agencies together. Other agencies have stepped up to the plate and said, hey, I think we need to have a special meeting about a certain issue. So all of the agencies are bringing things to the table, and we've had different agencies acting as facilitators and coordinators.
I've had several hands up. All right, David Osbourne first.
I just want to follow up on Lee's question and push you a little. It's very rare to have a budget office play a leading role in something like this, and it's very rare to get 5 other state agencies cooperating at the level that yours are cooperating. That's really a high hurdle that other states have to leap to do this. How confident are you that other states can replicate what you've done?
Well, I'd say 2 things. First of all, I think the budget office gets a bad rap for saying no and not wanting to do things. And in the state of Connecticut, and I suspect in other states, the budget office is always looking for effective solutions to social problems, and especially cost-effective solutions. So I would say that all other state agencies have a budget office. They all have agencies that deliver services and fund services now for homeless people. So they all have the same kind of structure already in place. So I do think it would be replicable in other states.
Yes, let's see. Ed, and then Ron, and then Maria. That's the order in which the hands went up.
I'm having trouble identifying the innovation here. Would you say the key innovation is the ability to get collaboration among those several agencies?
I would say that, and I would say also that supportive housing was really a new approach to homelessness. That before,
but that's not your innovation. That's been around for a
well,
while.
our innovation was bringing it on a statewide level. It had been done before on a citywide level or in certain localities, and we brought it statewide to over 30 communities in the state. So that's the innovation.
Janice, I think you maybe asked my question. One problem with dealing with the homelessness is that population that's got mental illness. Tell me about the service. You mentioned there were services attenuate to the housing. Can you speak a little more about how those relate to those that have more of a mental challenge?
Sure, because supportive housing is really geared toward folks who, without the services and just had housing alone, would end up back into homelessness, or if the services alone wouldn't work without the housing. The services are really oriented to trying to link the individual on a very individualized, flexible way to what that person needs. So if their issue is mental illness, it's trying to link them to the counseling they may need or the medications they might need. But it also is reconnecting with social connections, which may be an issue, and maybe reconnecting with employment. So it depends on the person and what they need, and so that's the real beauty of supportive housing, is it is very individualized.
Good, please.
Oh, no.
I'm sorry, Maria's.
All right. Following up on Lee's and David's question, there's no leader, if you will, I think you said, in terms of bringing these 5 agencies together, but oftentimes the experience of consensus and is that it delays. So how do you actually make decisions and come to closure and have a plan and then implement it?
Well, the budget office does have quite a bit of say in terms of if there are problems between 2 state agencies, that's our role in terms of working that out, and then ultimately, if it can't be worked out, to make that decision.
There were 2 more questions still pending, and time is up, but let's go ahead and take those 2 questions. You want-
This is very brief. Of all the people that you put in the supportive housing, how many have stayed there and not been homeless, and how many take advantage of the services you offer?
Most of the tenants actually take advantage of the services, upwards to close to 90%. And because the services are not required, they are voluntary. But we've also, on the first demonstration program that Connecticut did to kind of start out its efforts in supportive housing, they found that after 3 years, 2/3 of the tenants were still in the housing. And for the tenants who left, most of them left for positive reasons, such as going to other more independent housing.
Since, a final question, since a lot of this problem has arisen because of the deinstitutionalization that's occurred, is there a way that you can catch people earlier? Do they have to become homeless before they go into supportive housing?
You're really tapping into really the next generation of the supportive housing movement, and that is, there is an increasing focus on trying to catch people before they become homeless and really focusing on prevention, and both within the mental health system, but also within the correctional system as people are coming out of prison.
And do you think you can also move them towards more self-reliance on some of them on the other end of the process?
I'm sorry.
Will some people, in effect, can these in effect be halfway homes where they move toward self-reliance?
Absolutely. And we've had people who have gone from supportive housing into independent apartments and even to home ownership. So while that's not the mainstream of what happens, it is absolutely possible. And the goal is to really have people be able to move on toward greater independence, but not to put any artificial